Hello everyone, I am Dr. Sirisha, Senior Consultant in Pediatric Hematology Oncology and Bone Marrow Transplantation Unit in Banjara Hills, Hyderabad. 8th June is World Childhood Brain Tumor Day. We need to know more about brain tumors on this occasion because having awareness about brain tumors definitely helps in curing this problem in a better way. There are different types of brain tumors in children. First of all, we need to know what are the different types, how do they present, how do we diagnose them, how do we manage them, and how do we follow them. So first, if you take how do they present to us, what are the clinical symptoms? Common clinical symptoms are headache, vomiting, nausea, sometimes repeated vomitings, can get treated as gastritis and then later getting diagnosed as brain tumors also. Those kind of situations we have seen. And other symptoms are vision disturbance, problems with gait, that is walking difficulty, weakness in the hands, legs, or it may present even like a seizure, that is fits. So all these problems can occur with the brain tumors. Whenever the things are not explainable with the regular things, then we do think of things differently, and then we have to go ahead do the scans to diagnose the brain tumors. There are two types of scans, CT scan and MRI scan. MRI scan is a preferred mode of diagnosis in diagnosing the brain tumors. It gives better delineation and it doesn't have any radiation side effects on the young brains. Hence MRI brain is more preferred method. So once we do the imaging, we come to know where exactly the tumor is located. Once we know where the tumor is, then the next step will be taking the review of neurosurgeon, and at the same time we have to manage the child with the help of neurologists for associated neurological problems at that point of time. It may be seizure, it may be weakness, it may be other neurological issues. So as a team like pediatric oncologist, pediatrician, neurosurgeon, and pediatric neurologists have to come together and then manage these cases. And then at times intensivists also come into picture. If the child is very sick, they may get observed in the intensive care unit. So after imaging, we take the consultation of neurosurgeon, and then neurosurgeon will approach the child with the surgical resection, because first and mainstay of treatment for the brain tumors is surgical resection. Once neurosurgeon do the surgical resection, he send the specimen for pathology examination. With pathology examination, we will come to know what type of tumor we are dealing with. At times, pathology examination may not help. Pathology and IHC markers, that is immunohistochemistry markers, may not help. Then we also have to go ahead and do the tumor genetics. Tumor genetics will help in diagnosing the case appropriately as well as in risk stratifying the type of tumor, and it helps in further treatment of the tumors. So that is how we can approach the tumors. And then once we do that, then some of the cases requires radiation in the next step, and some we have to go ahead and give chemotherapy. I will come to that, where we go for chemotherapy as a second step and where we go for radiation as a second step. So before that, I should say what are the types of tumors, and then who require only surgery and who require complete comprehensive treatment. There are different types of tumors. So in that, like tumors like low-grade gliomas, they just require only surgical resection. After that, they may not require any further treatment like radiation or chemotherapy. We just follow them for few years. At times even up to 10 years also low-grade gliomas may require follow-up, but definitely up to 5 years they require follow-up to see the recurrence, and then they may require second look surgery and then plus minus further treatment based on the tumor genetics of the glioma and all. However, there are other types of tumors, that is malignant brain tumors, where, for example, medulloblastoma, where they first require surgery followed by radiation followed by chemotherapy. However, second and third treatment modalities order may change depending on the age. So if the child is less than 3 years old, so you don't want to irradiate their young brains because it can cause other consequences in the future. Hence, you want to go ahead and choose the chemotherapy as the second mode of treatment. That is, after surgery, you give chemotherapy and then you do autologous stem cell rescue following high dose chemotherapy. That is the treatment of modality for young children with malignant brain tumors. In our institute, even for 7-8 months baby also, like in this modality, surgery, high dose chemotherapy, intense chemotherapy followed by high dose chemotherapy and autologous stem cell rescue we have done, and then we rescued few children. So whereas if the child is above 3 years of age, after surgery we have to go ahead and do the radiation as a second stay of treatment, and then go for the chemotherapy to avoid the recurrence, which is called as adjuvant chemotherapy. So this is how one will approach. So these are the two examples of types of brain tumors, but there are various other tumors. Usually infants are at high risk of developing highly malignant brain tumors like ATRT, atypical teratoid rhabdoid tumors. These kind of tumors are more in infants or less than 2 years of age group. As such, infants like with highly malignant tumors like this comes under high risk category. So overall, if you look at high risk, low grade tumors or tumors that come in between, all these if you look at the overall survival rates, up to 75% are getting cured in long term, leading normal life. So most of the times we do think that brain tumors are not curable, but brain tumors with proper approach, with comprehensive care, with as a team, if we work as a team, they are curable and they are leading normal life in long run with a appropriate approach. So that is what we need to remember. And a few more things in advances what we need to remember is one is tumor genetics. I already mentioned, they are helping in risk stratifying them, in identifying the type of tumor, in choosing the appropriate treatment. That is one thing. And other thing I already mentioned, that is for infants, high risk tumors, after surgical resection and after giving chemotherapy, one can prevent the recurrence by doing high dose chemotherapy and autologous stem cell rescue. These advances are helping even high risk tumors in young babies to get better in long run. So with these things, with comprehensive care approach, yes, the results are definitely better, much better compared to what it was earlier.